first thing to do is walk up to the patient, BSI. If they're unconscious, you want to make sure they're inline stabilization. You want to try and make sure that the patient is, we can wake the patient up. We don't do sternal rubs anymore in California. They are done. Don't let a fire captain, anybody see you. You better yet, just don't do it, because if it leaves a bruise, they can sue you. So just kind of shake them, sir, ma'am, are you okay? Can you wake up? Pinch their trapezius, pinch the finger, do whatever you're going to do, try and wake them up. If they're not awake, or if they are awake, if they're awake, then we want to find out what they're alert to. AVPU, things like that. All right. After that, we want to go into what? We want to check our pupils. What are we checking our pupils for?
Size, quality, reactivity to light.
So it's pearl, right?
Yeah.
All right. Now, you really can't check these, so just kind of make it look like you're checking them. Show the proctor how you would check them. I'd open the eye, start from the outside in. I'm looking for reactivity. I'm checking for the size, things like that, whatever else. After we get our pupils done, what are we going to do next?
Ask the questions. What happened? Where are you? What time is it? Level of consciousness. What's your name?
Have we done that yet?
Yes.
Are we supposed to do it now or earlier? That's up to you. You guys need to let me know. You guys earlier. All right then. So we got the patient. Patient's up. So we've done our AVP and whatnot. So now we need to ask him the 4 questions. What are the 4 questions?
What time? What happened? Where are you? What time is it?
All right. Good. Now we move on to pearl, right? Then we move on to what? All right. Show me how to do the upper extremities for PMS.
The upper extremity?
What are you going to check on for PMS and upper extremities?
You check for the pulse.
Okay.
Tell them to squeeze your hand.
Okay.
Tell them what finger you're touching.
Okay.
Tell them to push down on your hand. Is that it?
Move the fingers.
Move your
You
fingers.
tell them to move your fingers.
Now, the reason we're having the patient squeeze our hands is because we want to make sure that they have equal grip strength. Because if you have diminished on one side or the other, it's a good possibility that they might have a head injury, which is an indication. So you guys know that if you have a right-sided stroke, it happens on the left side of the brain, right? Same thing with this. If you have diminished on the right, more than likely it's happened on the left. All you got to do is in your report state that on PMS, grip strength was diminished on the left, solid on the right, something like that, just so that the doctors and the nurses know what's going on when you bring them in. Show me the lower extremities.
Check for pulse. Have the patient push down,
Okay.
go back on
All
the
right.
hand. And check for sensation.
What else?
In the toes.
Same thing we did up here happens down here too.
You check for swell.
That.
Pitting.
What was the last thing we just said?
See what was toes.
Wiggle the toes. Exactly. Same thing with the feet. We want equal pressure, pushing down and pulling back on both feet. If not, it needs to be documented. Most of the time, if it happened on the left hand, it's going to happen on the left foot. Right hand, right foot. You're really not going to have too much of a cross. So right hand, left foot. If you do, then they're just totally kind of fucked up. So the only other thing you have to say at the end after you've done your PMS to the proctor is I would now document my if they're AVPU, the LOC, the PMS in the upper lower extremities, and the paramedic would give a Glasgow Coma scale. It's done. That's your neuro exam. So that happens between primary and the start of the secondary. All right. So that's it.
I think someone asked you that. So you're going to go to primary, and then you're going to go right into the neurology, and then you're going to go into secondary.
It's done.